Hey y'all, welcome back to TIC Talk. Two insurance chicks talking insurance. It's a rowdy topic.
Oh, it's always rowdy.
So today on the show, we're going to discuss if the Affordable Care Act is actually affordable. Spoiler alert, it is not.
Not.
Right. So welcome back to TikTok, y'all. Today we're going to break down and discuss some real options that you have going into this open enrollment of 2026. It's going to be considered because your plans don't go into effect until January 1, 2026. And you will have between this November 1st to December 15th to get a January 1 start date, and December 16th to January 15th to have a February start date.
Correct. Absolutely. And we are here to just give you the basics on insurance and the Affordable Care Act as a whole. Yes, the question today was, is it affordable? And for the middle class and the upper class, it is not, um, because it wasn't designed for us, really. It was designed for lower income and people who have major pre-existing uh, conditions that need extensive treatment. So we
Right.
will go over some just simple terminology. We are here to make it make sense. And as we've already discussed, today's topic is a big one. It's something that we have had to answer the majority of our career.
Right. Correct. It's the $1 million question. Well, really, the $1 billion question, $350 billion to be exact. I mean, if you've seen the latest numbers from the Wall Street Journal, which not a huge fan of the Wall Street Journal, but nevertheless, it's a pretty big nationally syndicated paper. Um,
Hmm.
and it said, that the Affordable Care Act was actually never really affordable, but me and you as agents and most of the Americans that are on those policies knew that already. Okay, so, what do you think are going to be the changes we'll see in 2026, Bettina?
I think one of the things will be increased, the subsidized amounts will be lower for certain income class. Last year and the year before, it was increased. So you could make 80,000 and still get a $300 subsidy. For people that make, anywhere from 80 to 120, those thresholds are going to be lowered. So premiums are going to go higher. And unfortunately, the only way, for anything to level out is to certain parameters in place so that the people that really need it get it, and the people that don't per se um, look at other options that really do fit them better in the long run anyway.
Right.
That's going to be the only way that the Affordable Care Act is really going to work like it's supposed to, so that as a whole, private insurance carriers can lower or at least level out their premiums, so that uh, people that are healthy are getting on those, and people that have pre-existing and are in lower income bracket get on the marketplace.
Yeah, because since the government is closed, right, they haven't been able to put in that continuing resolution bill, which would do something to the subsidies. Who really knows? So they're probably not going to be the same. We definitely know that they're going to increase from those 2020 prices when they started to implement the COVID tax cuts for those particular plans on the ACA. And the thing is that the ACA has helped a lot of people in reality. It has. Sure, there's scenarios where the deductibles were high, but they had care, is the point.
Right.
Um, but it's not fixing the root cause of the problem, which is cost of care. I
Mm.
mean, even with the subsidies, right? Many families are paying thousands and thousands and thousands of dollars before their insurance even kicks in. Like we talked about in the last video when we added the premiums together
Mhm.
and the deductibles, and then it greatly increased your monthly spend. In reality, that pesky deductible is always kind of the Achilles heel for everybody because it doesn't matter what your premium is, your deductible is still going to be relatively high for your family. And the deductible, like we discussed, is the amount that you have to pay in before the insurance starts paying anything back. So, um, are going to talk about some alternatives.
Absolutely. And another thing too could, and I mean that's the thing that we hear of a lot. Unfortunately,
Yep.
it is going to happen. We hear all the time about families that come in ask or saying to us, "Dude, we pay $1,200 a month with a $7,000 to $8,000 deductible, and it's an HMO." We also, if I'm not mistaken, we did emphasize on that a little bit the difference between HMOs and PPOs. PPOs,
Right.
if you didn't get to hear the last session, is stands for Provider Preferred Organization, which allows you to see both in-network and out-of-network providers. Most of the private plans have um, PPOs because they want you to be able to go anywhere and get the treatment that you need when you need it, per se.
Right.
Most marketplace plans are HMOs or EPOs. There's a few states that offer PPOs, but it's not the true PPOs that you see on the private plans. But we see this a lot, and that's where private plans come in and not only lower your out of pocket, but lower your premiums, give you better access to doctors, and allow you to, I hate to say it, but um, level with the hospitals and providers because you're becoming educated. And unfortunately, a lot of facilities and unfortunately, certain institutions do not want you to be educated because they just want you to pay the price tag and move on. Uh,
Right. And not ask any questions about,
what's
in
going
reality,
forward, where it's
why is
going
my
to.
deductible so right?
Right. And so
Why?
if you really look down to it and why the marketplace is so high, back in 2008 when it came on board, Blue Cross Blue Shield at that time was offering like underwritten plans. It weren't like true underwritten, but they would do like rate ups, kind of like what our new era plans do now. Uh,
Yeah.
they would offer rate ups, and I mean, Blue Cross Blue Shield has always been expensive, but they weren't as expensive as they are now. And so
Oh no.
it allowed them to be able to be competitive, offering that. But then when the marketplace came in and they started offering, no pre-existing, no questions, no nothing, in order for these, I call it the big box insurance companies, to compete, they had to be able to offer the same or similar. And so that only just made things worse in the insurance world. And unfortunately skyrocketed the premiums. And so it's like I said last week, when you look at a bucket of good apples and then you look at a bucket of good and bad apples 50-50, the bad apples are going to weigh down the good apples, and eventually people ask, why am I paying a higher premium if I'm healthy? Well, because you're participating
Subsidizing.
in the same group per se that the bad apples are. And I mean, it's not their fault that they have pre-existing conditions. But unfortunately, when you are on the marketplace, your rate is not based on you; it's based on the average people as a whole in your area. That's why states vary. That's why premiums vary state to state. It's based on geographical location and age, and obviously at the end of it, it's based on your income. So people ask, and that's why, you know.
Yeah, exactly. I mean, we talk to people that are paying, 12, 15, $2,000 a month sometimes
Mhm.
on these ACA plans with these high deductibles, and we're able to reduce their premiums by usually close to half a lot of the times,
Right.
or two, a third at least. And we have plans that offer upfront coverage. So a lot of times, what it looks like is one, you can either cash pay and
Mhm.
then send the claim into the insurance company for a reimbursement. Or if the doctor does take the insurance, with most do on the PPO network, it's a nationwide PPO too, not just statewide. um, then you get the negotiated rate plus your benefit applied. And that benefit plays the same no matter where you go, no matter what hospital, doctor, or anything like that that you go to. That plan is going to pay that fixed benefit no matter what. So these plans are typically through like New Era. We have some indemnities that are through the United Healthcare. We have indemnities through Allstate and National General,
Mhm.
as well as the NCBA. So, in plain terms, what happens is it's like you're buying a plan that already has set amounts that it's going to pay for visit. Plus, it gives you tools that you can use to find the most affordable cost for an x ray, a CAT scan. We have some that have labs for a $7 draw fee for up to 100 labs. Or $0 prescriptions for 1,000 prescriptions, guaranteed life insurance. We just have a ton of policies available to help lower people's bottom line and get them better coverage. And everything's going to be about price transparency in these coming years. Americans are going to demand what does this cost? I want an explanation why it costs this. And then they want to be able to pay for it using the insurance that they buy and they pay for monthly.
Right, absolutely. And there are ways to, like what Talia just said, to utilize insurance to and allow it to benefit you. Like I said, these places, when you go to a provider, they automatically have a designated pre-negotiated amount with the carriers. So this
Yes.
through PPO plan, the reason why they pre-negotiate these rates with the carriers is because they pay out. They don't like dealing with certain carriers because they don't pay out, and I don't blame them. I mean, it's just like when we
Yeah.
provide a service, we want to get paid. So, we want to deal with people that value us enough to do so. And it also comes down to something that we talked about a little bit before, about health sharing plans and it not really being a true insurance plan. Yes, we have pretty much everything on the market, both publicly and privately, but we also want to educate you on what is insurance and what is not. Um,
Health share, not insurance. Med share, not insurance. Care share, whatever that is saying it's a crowd share. That's crowdfunding your health insurance. Why would you risk that? They're not insurance.
right,
Now they're helpful. Don't get me wrong. They're a nice alternative for people, sure, but it's not insurance, and they shouldn't be marketed
right,
as
absolutely.
insurance like they usually do.
Oh, and
Uh,
they do. I've had people, unfortunately, physically tell me that, oh, well, this health sharing plan has this deductible. And I'm like, you're not allowed to use that term. Um, because
yeah,
a deductible is defined as a certain amount that you have to pay before your insurance kicks in. And there's
right,
nothing that guarantees that your claims get paid. You cannot use that term. Most actual brochures mention PRA, which is a primary responsibility amount. I actually talked to somebody about it. And, another thing too, and I hate to say this, but I'm going to anyway, is, a lot of these people that offer these health sharing plans are not licensed agents. They have
correct. They're just
hours
salespeople
worth of training and 2 weeks of experience.
and
Whereas,
thousands of dollars on our licenses. Yeah,
whereas we have over 20 years combined together. We have worked for, of course, we like to stay, you know, longevity in our positions. So but we have actually
right,
worked at a couple different insurance carriers, one captive and one not. And of course, captive is great for new agents, not for senior agents. Um, but nonetheless, we've got a decade's worth of experience where we know what we're talking about. We know what's what pays out and what doesn't, unfortunately. and we know
Right,
what
and
options are the best per client per scenario. Because you think about it, every time we talk to somebody, we're coming up with a solution to help them.
right, with some
Everybody
kind
else
of
does. We're
problem that
coming up
they
with a
have or
solution using our experience and our education in the insurance world to help people. And so it's kind of uh, a slap in the face when you hear people talking about, well, this person told me this, and I'm like, well, this person doesn't have 20 years of experience.
right, or,
We're not
hasn't
selling
been
an
in the
insurance
industry
plan.
for longer, worked in every sector like myself, where
Hmm.
I worked in billing before, I've worked in customer generation for prescription drugs and durable medical equipment. And then I got my insurance license, and now I've been doing this for a long time, and I've seen it all sides of it, working the claims for the customers, helping doctors make sure they get prior authorizations or what they need. But what's great about most of the plans that we offer on the private sector is you really don't need prior authorizations. You
Right,
really don't need any of these extra steps that these bigger carriers on the marketplace make you go through to get your claims paid. It's important to note that you can save a lot of money going a different way. You could save yourself a lot of money and heartache, time, frustration by actually reaching out to an agent,
right.
calling me, calling Bettina, calling an agent that's local to your area if you want. We can connect you with them. Um, that way you have someone that can explain to you how your policy works, what you're paying, what A, B, C, and D look like. Um,
Hmm.
and it's important to remember going into open enrollment, there's a couple things you want to know, right?
Right.
What's going on with that subsidy level, Bettina? Because what you don't want to do is end up collecting a giant subsidy and then not qualifying for it next year.
Hmm.
You always want to update the marketplace with those. There's a couple carriers that once I get confirmation that are leaving the market, we'll tell our listeners or viewers who they are.
Hmm.
Um, and I can't mention it enough to just engage with an agent because we're pretty knowledgeable. If you're an agent that has one policy, no, they're probably going to just try to sell you um, that policy that they have for lack of better resources or terms I have. Um, but if you work with a broker, they have access to so many policies. Like um, I'm licensed with ACA carriers in multiple different states. I'm licensed with United Healthcare on the private sector and on the marketplace. I'm licensed. I'm appointed with Cigna, New Era, Assurity, LifeX, Iron Health, United Healthcare, Allstate, National General. So we can just keep going down the list of where me and Bettina are appointed. But um, you can see we have lots of options, and we're more than happy to help you walk through this open enrollment. And it's important, like, subscribe, follow us on our social medias, send us an email,
Absolutely.
call us, ring a ding ding. We'll answer any of your questions, concerns that you might have regarding this open enrollment. It's going to be exciting. A lot of new things are happening.
Absolutely. And just to recap a little bit, the bottom line is the Affordable Care Act really didn't, um, I mean, it helped, but it didn't solve.
No,
It was like putting a band aid on
on a
something
bullet hole.
without taking antibiotics. It doesn't get rid of
Yep.
it. It just,
And nothing's really going to change unless we all bond together and you let us show you what we got or speak with a broker because it's going to come from us demanding price transparency
oh,
and
yes.
affordable plans and plans that actually cover your medical bills. Because in the beginning, we said it, what's the point? The point is to prevent you from severe catastrophic financial burden in the event that you have a heart attack, a stroke, major organ failure, kidney failure, anything crazy like that.
Absolutely. So, to wrap things up, we are here to help you
Yeah.
with your health. and your wallet.
So like, subscribe, share, engage,
Ask
and
us
we'll help you
questions.
yeah, we'll help you however we can. And we'll see ya next time. Hopefully, we'll be doing another episode this week, going deeper into the topic as more information comes out. If we hear anything regarding the subsidy level, we will post it here first. So, yeah, I hope everyone has a great day. Like, follow, subscribe, all that good stuff.
And we'll see you on the next one.
Adios. Ciao. Okay, so